Tobacco use is a common problem that we encounter in patients with drinking problems. In this module, we'll learn how to assess tobacco use, how to assess patients' level of motivation, how to address it appropriately, and finally, how to prevent and deal with a relapse. As a routine procedure, we should ask all our patients about the use of tobacco in the last part of our assessment. Once we finish our assessment of tobacco use, we should explain to our patient that this intervention is primarily focused on drinking problems, but if they want to work on their tobacco problem, we can help them to try to stop or control its use once we have finished with the alcohol treatment. Sometimes it's also possible that our patient or his significant other may disclose the use of tobacco as their primary concern and want to work on that problem before the alcohol problem. When this happens, it is important to make the patient aware in a collaborative manner that the focus of this intervention is drinking problems. And though the use of tobacco is also important, we will handle that only once we finish delivering the alcohol intervention. This slide lists the important things that you should be asking the patient during your assessment. How do we help a patient who has a tobacco problem? This is not much different to helping your patient with the drinking problems. Similar to patients with drinking problems, patients with tobacco use can also be divided into three groups based on their motivation to quit tobacco. We need to match our intervention to each patient's level of motivation as described in the table in this slide. What do we do with patients who have feelings of ambivalence or do not feel motivated to stop their tobacco use? In these patients, we use the same skills that we used in the building and developing patients' motivation for change module in the CAP treatment. In such patients, we would do a detailed assessment. We would provide personalized feedback about tobacco use. And this personalized feedback should include a summary of information gathered during assessment, followed by providing information about the adverse effects of tobacco on the body. Once a patient decides he or she wants to change or stop the tobacco use, congratulate the patient. Find out from them the reason why they want to stop the tobacco use. It's very important to assist the patient in setting a quit date. Don't let the patient postpone. Ask for a decision and ask the patient to mark this quit date on a calendar. Some patients might choose a date which holds some special significance, such as a religious occasion or a family member's birthday. Others might just pick up a random date. It's helpful if the significant others are involved in the decision, just like in the treatment for alcohol problems. Encourage the smoker to ask for and accept offers of external help, like from family and friends. Finally, we have to remember that there is no one right way to quit. Some tobacco users prefer to quit by stopping it completely and all at once. That is, they use tobacco until they quit date and then stop totally. On the other hand, there are others who may cut down on tobacco for a week or two before their quit date. You have to give the patient the choice to decide the way they would prefer to do that. Details about what to tell patients who want to taper and what to tell those who want to stop directly are in the manual. Similarly, details about prevention and management and lapse and relapse management are also there in the manual. In this slide, you will see suggestions for patients who want to taper their tobacco use slowly. In this slide, we have suggestions for patients who want to stop all at once. Finally, this slide tells us about how to help a patient prevent a lapse or a relapse, or how to deal with a lapse or relapse when it happens. This is not any different from the skills that we tell the patient to use when they stop or reduce their drinking.